Very good evening, friends. Meeting again in the session of Organon philosophy, and we're discussing the Roberts philosophy, the second year syllabus. We are discussing regarding the chapter number 8, and we have finished in last lecture, that is the taking the case. And next part after case taking comes making a totality and analyzing the case. So this is very important aspect. There are very specific steps. If you follow the steps, then it becomes simple to reach to the remedy. And that's why even Robert has written it in sequence. So he has written the first chapter, that taking the case, followed by the analysis of the case. So we'll start with the chapter number 9, that is the analysis of the case. So how to analyze a case? Analysis is nothing but categorizing of the symptoms. It's called as an analysis. But here he is not explaining about the analysis of the totality of symptoms. He is explaining about the analysis of the case first. So what he says in chapter number 9, analysis of the case. In analysis of the case, the value of symptoms must be taken into consideration on several points. So value is more important, which is most important, which is less important, which is common, all those things. First, the personality, the individuality of the patient must stand out preeminently in the picture. So what he says, the personality is most important factor, followed by the individuality of the patient. You have to find it out, individuality of each and every patient must stand out preeminently in the picture. So what is characteristic enough which defines the personality of that specific individual, and a remedy that is more important for you, with which you can approach to the case. And that's why he says personality. That means nothing but the individuality of that person, which will guide you toward the remedy. This can be illustrated by likening the whole symptomatology to a complete picture of whole individual, whole personality. So you have to go through the whole case. You have to find it out what is there. You have to make a totality. You have to give a holistic approach to look towards the thing, and then you have to think what type of personality it is. This embraces not only his physical characteristic, but the expressions of his mental and emotional characteristics as well. So when you make a totality, everything should come over there. The physical features, the particulars, then the physical generals, then the mental generals, the emotionals, everything will come and in your totality of the symptom. But in each case, the value of that symptom depends upon that specific case. Sometimes it is strong physical characteristic, physical general characteristic can come as a top. In some cases, it might be a mental general. In some cases, it might be emotional. It varies from case to case. And that's why you must find it out whole totality, which is consisting of physical generals as well as mental generals and emotionals. While the general ranks the highest in the evaluating case, and without generals, we cannot expect to find the minimum. The mental and emotional characteristics have a high value, since these are true reflections of his personality, the man himself. So what he is explaining, in your case, if you are not getting the generals or physical generals, the mental emotional characteristics have a very high value. In fact, in mental generals, the specifically the symptoms which are related with the will and emotions, then followed by intellect and understanding, then followed by memory. These are very important. Those defines the individuality of that person, because of which it is quite easy to reach to the remedy. And that's why whenever you are thinking about the totality, if your totality is made up of mental generals and emotional symptoms, it ranks the high. Because the subjective symptoms are the registration of his physical and other difficulties as expressed upon his own personality. These are also of a great value. Subjectives are more important. Sometimes patient explains the symptoms in the form of some location, sensation, modality, concomitant, everything is giving you while writing. Everything matters a lot, because sometimes it is the characteristic which defines you the remedy. So for example, if a patient comes, he is having very specifically the severe headache and it starts from occiput, it goes to top of the head, and then it settles with the left eyebrow or eye, and then the whole eye is also paining, it is throbbing, and it is neuralgic pains along with the whole face left sided gets affected, associated with the palpitation. So this is physical general, particular, in fact, not physical general, this is particular. But this particular is so strong that you are able to reach to the remedy. Yes, Dr. Kirtika, she has rightly said it is Phygelia, correct. You are coming to it because you know the characteristicness of that particular. This is too important to know. Once you know that, then it becomes simple. So what he says, because the subjective symptoms are registration of physical and other difficulties as expressed upon his own personality, these are also of great value. The objective symptoms are less differentiative, yet their value lies in the fact that they cannot be distorted by design of the patient. He little realizes that he is manifesting these objective symptoms, and therefore they picture accurately certain phases of the case. Sometimes you get objective symptom. For example, patient comes and patient comes with a typical objective symptom. He is having the warts on his face. On the basis of warts, you cannot find it out directly a remedy, because that objective symptom is less differentiating. For patient, it matters a lot, but for you, it never matters because it doesn't have a symptom, it is a sign. But if I will tell you one case which I have presented and I got the prize in 2003 in case competition presentation. That was a lady at the age of 75 came to me with a single wart over here on the neck. And she came and she said, Doctor, I want to remove this. Actually, I went to the surgeon and he said that you have already operated for 4-5 times in your life. I cannot do a surgery. You take the homeopathy. And she came and she said, Doctor, how it looks? It never looks good, no? There is a marriage of my my grandson, and then what people will say, if I am having what? And she is from very appearing in a noble manner. She was quite well dressed. And she said, Doctor, this is not good. I never liked this type. How my personality is. And then the history told, whatever history told, she was operated 35 years back with say a breast. Then she was operated for thyroidectomy. She was operated for appendicectomy. She was operated for bypass graft and everything. And what she is coming, the what's over there. So this is very important. The looking towards the what with a different angle shows that she is very beauty oriented. At the age of 75, coming for a single wart, history of carcinoma, and now we get, yes, this is carcinosis. So we must know all those things. So every time that objective symptom never gives you such details, but how the person look toward that objective symptom, it matters a lot many times. And that's why it also has a value. Objective symptoms, those that are seen by careful observer, have more importance in child life than in adult life, because through them we see expression of child's dispositions and desires. So objective symptoms we can observe very clearly. In children, you cannot get the history. Children are not will not going to give detail. Yes, doctor, I am having this and this symptom, and so he will not going to explain each and every detail, even though he is talking. If he is very small infant, then it is always a question of your observation. Then your observation should be so strong that you have to observe what exactly is there and you can catch that. If the infant who is 4 months old was brought to you with nasal blockage and coryza and he is not able to getting a feeding because of obstructed nose, and patient child is there, infant is there 4 months, and who cannot go to the nipples because the child cannot suck the So what remedy? It depends upon your observation and it depends upon your mm, understanding about the remedy. So what is the remedy? Yes,
Ambiguous.
correct, very correct, very correct. It is ambiguous nigra. Sambucus is very good remedy and which opens the nose so nicely in infants. So this is what the importance of it lies. In children, yes, definitely the objective symptom plays the role. Then a child who is sitting in front of you and boring his nose, this is the symptom which you are getting, you are observing. These are things one should not miss. If he is there in your consulting room and he's craving for chocolate, he's asking mother regarding the, so you observe that is more important. That is what is called as a perceiving. Therefore, many of the seemingly objective symptoms may be translated into subjective form. It is for us to interpret the symptoms according to our understanding of its proper value. While they may be presented to us in child life almost entirely as objective symptoms, yet they may have their counterpart subjectively in the proving. So see how nicely he has explained that these are the symptoms which look to be objective, but these are not objective. These are subjective for that infant, for that child, which they are not able to explain, but which you have catched and they are subjective for that specific individual. So those symptoms are very essential in order to reach to the right remedy. You should be very watchful in fact when you deal with such types of cases. Specifically, if the patient who is in coma, then again you have to look for what is there in the case, what you are observing, what is specific of that coma, how the person is reacting, whether he is reacting or not reacting. Everything matters a lot because that will guide you towards the remedy. So it is not possible so easy to reach to the remedy, specifically in children, infants, or in cases who are in the comas. Then he says, now in taking a case, we must take into consideration the nature of disease and its peculiar types. We must know disease accurately before we can give effective relief. What he is saying? Now in taking a case, we must take into consideration nature of disease and its peculiar types. So you should not miss the disease also. You must know disease. We must know disease accurately before we can give effective relief. So that is the knowledge of disease, comma indication, which he has mentioned in third aphorism. If we know what we are treating, we can treat him properly. Occasional cures takes place without such knowledge, but it is almost by accident. Very important sentence. Sometimes you get results with cases in such manner, but they are temporary or they are accidental. Luckily, gunshot therapy. It is not like that you have purposefully finding the remedy and giving it to the patient without knowing what you are treating. This is wrong. That is, we must know its peculiar manifestation in each individual case, taking into consideration its complete symptom totality. The complete knowledge of the case is associated with another important item. We must know and possess the means by which we are able to relieve. Without this latter knowledge, any knowledge of the symptom is of no avail. See what he is explaining. He is explaining that you must know what you are treating. You must know you are treating the cancer, which type of cancer, what is the prognosis, what are possibilities, what it may cause. You must know each and every pathology. If you are thorough with that, then you are approaching in a scientific manner to that case. If the patient with the cervical spondylosis comes to you, if you diagnose that it is cervical spondylosis, then your homeopathic management depends upon it. It is not just giving a remedy to the patient. Here you have to manage that case as an individual, and here you have to take into consideration every aspect of it. So these are things which he is mentioning, and these are very, very essential for you. And these things one must not forget. And then he says, there has been a great knowledge of disease attained from investigators from the earliest times. Methods have been improved whereby diagnostic symptoms have been correlated, and all praise is due to the investigators along this time. The only difficulty is that diseases have come to be treated by names of diseases instead of by individual symptoms. The disease has been treated rather than the patient. It is only upon the totality of symptoms that we can base our prescription, and so we require many individual symptoms as showing the characteristics and personalities of the patient. So these diagnostic symptoms are of very little use to the homeopathic prescriber in selecting the remedy. So what he is explaining? He is explaining that previously they used to give importance to the symptoms to find it out what is the diagnosis. But diagnosis is always based upon the common symptom. It is not based upon the characteristic symptom. So everything, if there is a so severe pain in throat and you ask the patient to open the mouth and tonsils are enlarged, you label it is tonsillitis. But tonsillitis word never gives you the remedy in homeopathy. Patient is having very typically the pain in right iliac fossa with severe vomiting, with fever, with constipation, and you come to the conclusion this might be appendicitis. But knowing the appendicitis, you cannot prescribe the remedy. You must know exactly how the patient is presenting that appendicitis, how that patient of tonsillitis presenting the tonsillitis, the man behind the tonsillitis, the man behind the appendicitis is very important. And if you are able to get that, if you are able to get that totality, then it is possible to reach to the remedy. So diagnostic symptoms and diagnosis never gives you the remedy, but still it is needed in order to understand what you are treating. And for your prognosis of the case depends upon the name of the disease, as well as you can understand the disease pathogenesis on the basis of that. You can find it out the depth of remedy on the basis of that, or decide your remedy, the depth of action of the remedy. So for that purpose it is necessary, but it will not guide you towards the remedy. And what it says, in fact, the similimum is practically never found among the diagnostic symptoms. So you cannot get a similimum on the diagnostic symptom. In considering the diagnostic symptoms in the selection of remedy, it's only of a practical value is in excluding those remedies from the consideration which do not correspond to the genius of the disease, but act chiefly on other parts of the organism. So you might come to the remedy not on the diagnosis, you come to the remedy on the basis of the characteristicness of that specific symptom which the patient is presenting. So it depends how the patient presents. So patient comes to you with a severe headache and he explains, I'm having a headache over there, and he is defining it with the tip of your finger, his finger. So here the headache is not important. How he is presenting headache is important. So these are things which you have to look for, because those are things which guides you towards the remedy. There the individuality is hidden. It is not hidden in the headache. So if it has been indicated with the tip of the finger and he's saying that yesterday it was here, now it is there, and now here, and he is explaining it with the tip of the finger, that means there is a pain in spots which is wandering from one place to another place. And then you think it might be a Kalibaikomism. So this is how you have to look for. So diagnosis never gives you the remedy, but the presentation of it definitely gives you the remedy. And what he says, if we allow ourselves to become influenced by the diagnosis in making our remedy selection, we are very apt to become confused and fail to help our patient. So we should not depend our prescription on the basis of diagnosis. It will not guide you towards the remedy. If you will going to fail if you think your prescription on the diagnosis. We may be faced with the diagnosis of some grave condition, such as some form of deep abscess, a grave pneumonia condition, an internal hemorrhage, or any one of the host of conditions. Selection of the remedy on the basis of diagnosis may and probably will fail completely. On the basis of diagnosis, you can think what pathology is there, whether the patient is having internal bleeding, whether the patient is having ovarian cyst which is ruptured, or whether the patient is having any torsion of the ovaries. If anything, if you are able to diagnose, then you will going to act properly. And for that purpose, it is necessary. It will not guide you towards the remedy. So The diagnosis is important to understand what exactly the disease is. However, the symptoms of the patient are an infallible guide, and the more serious the condition, the clear cut the indications for the remedy. Again, he is explaining one more hint or giving one more hint. If you get very clear cut symptoms in acute case, rather it is a very acute, specific, grave condition. But if you are getting symptoms, then your work becomes very easy. If you get very characteristic symptoms, then you get or you can catch things very easily. You are called that patient is having little bit breathlessness and he's having little bit chest pain, and you are called over there and you see that patient's pulse, which is a little bit feeble, and it is having every alternate beat or every third beat, there is a miss beat, and patient is having little bit edema over the lower extremities, and patient's pulse is absolutely weak enough. So here you can catch that there is every time the miss beats are there, every on a third beat or fifth beat or seventh beat. Yes, you get the characteristics on the basis of. Then you can catch, yes, it is a digitalis. So unless it becomes characteristic, you cannot find it out a remedy. And this is what he is explaining. However, the symptoms of the patients are an infallible guide, and more serious the condition, clear cut are the indications for the remedy. If we allow ourselves to be guided by these symptoms, we shall probably save the patient, even though the remedy selected on basis of symptom totality may never have been used under like diagnostic conditions before. So what he is saying, if we allow ourselves to be guided by these symptoms, we shall probably save the patient, even though the remedy selected on the basis of symptoms totality may never have been used under the diagnostic conditions before. So your diagnosis is important in order to find it out exactly what the disease is. But at the same time, your remedy never depends upon it. Your remedy depends how it presents. So every patient who comes to you, if a patient is there who is, you are called at the night suffering from severe asthmatic attack, and you are called for house visit and home visit, and you are asked to come over there because patient, it is not possible for patient to come over there for the treatment. The patient is lying over there and he's lying on bed and severe breathless, and his hands are wide apart and he's having whole covering on the body, and he is taking a breath and he is in lying down position over there. You go to home, you observe this, and this is summer, and he is lying with the covering and he is having a breathlessness, and then you ask why you have so covered. He says, I'm too chilly, I'm feeling too chilly, it is summer heat, and patient is feeling too chilly. Asthma, better by lying in bed with hands wide apart. Yes, Kirtika, she has very rightly said, it is a Sorayan. So here you must know the diagnosis asthma. At the same time, you must know how this asthma is getting presented over there. And this is the approach in homeopathy. So in the analysis of the case, you have to look for both the things. What are the diagnostic symptoms and what are the characteristic symptoms which gets presented over there. I think it's better to stop over here, and we'll meet up day after tomorrow. On tomorrow, there will be no lecture. We'll meet on 2nd of May. So that's all for today. And today evening, we're going to learn one more remedy, the Kali bromatum, a very deep acting important remedy from our Materia Medica. So at 15, we'll have Kali bromatum. What advice should we give for cervical spondylitis? Most important, if it is cervical spondylosis, then you have to ask for specific cervical exercises, neck exercises. That is more important. If it is cervical spondylosis is associated with radiating pain in the hands, then accordingly you have to ask the patient regarding that thing. Then patient might require cervical traction if the disc is of more severe character. If it is only because of spondylosis degeneration, then you have to ask the patient to utilize sometimes a cervical collar. Maybe it depends, it varies from individual to individual. But if you know the diagnosis, then you can act. And that's why the importance of diagnosis is there. Okay, so that's all for today.
Thank you very much, sir.
Thank you. We'll meet again at 8:50.
Yes, sir. Yes, sir.